Hello, and this is Paul Sost, and I will be taking you through this handpiece maintenance PowerPoint. This is an actual PowerPoint that you can feel comfortable bringing into an office, and we're going to go through it today because it's got a lot of great information for you as a technician. But this is a PowerPoint that can be taken into an office at a lunchtime, bring in some sandwiches, and go through this with the staff. In order to try to help educate the staff on handpiece maintenance. The first thing you'd want to talk about is your handpiece maintenance goals. As in the prior video that we went over, to achieve optimal performance and maximize longevity. Obviously, in order to do that, one of the things you have to do is lubricate your handpieces, and this is a brand of lubricant that you can buy from Vector that is very similar to a product that the Cavo has, and can go actually into an automatic handpiece cleaner, Quattro Care, made by Cavo. Excuse me. It's an advanced all synthetic product that will not break down in the heat of your sterilizer, as mineral oil-based lubricants tend to do. So this is an upsell for a doctor. You're going to be lubing your handpieces with the mineral oil-based lubricants with droppers, but an office absolutely should look into lubing their handpieces with some kind of a synthetic product such as Vector. Step one in the maintenance process. Wipe down the handpiece after use of each patient. Wipe down the exterior with a 2x2 gauze lightly damped with pure rubbing alcohol, or use a toothbrush and pure rubbing alcohol. Do not use alcohol wipes. They have a lot of other chemicals in them other than alcohol, and it will start to deteriorate the O-rings, and it will start to deteriorate the handpiece. So that's very important. The office has to use pure alcohol. After wiping it down, the office should lubricate it using the correct lubricate adapter, which is there on your left-hand side. That's just one adapter of several, depending on the handpiece that you're using. Spray the Vector lubricant for approximately 2 seconds into the back of the handpiece, or insert 3 drops of handpiece oil into the drive air tube, which is shown on the right-hand side. Oil gets inserted into the drive air tube on the left side when the small holes are pointed up. If using Vector spray, the adapter will direct to the lubricant to the drive air line. Basically, your drive air line is your smaller of the 2 outside diameter tubes. So you've got 2 large tubes, you've got 2 small ones. Disregard the small ones. You've got the 2 big ones. The larger outside diameter would be your exhaust. Your smaller outside diameter would be your drive air, and that's where the oil would actually be put in. Lightly spray Vector lubricant into the handpiece chuck, or place a drop of handpiece oil to the front of the spindle. This will extend the life of the spindle. This is a step that most techs forget to do, and is really critical to get some lubrication into the chucking mechanism. To do this properly, your chuck needs to be in the open position. So that means if you've got a push-button handpiece, you need to hold the handpiece button in, and then you can insert the oil into an open chucking mechanism. I'm sorry, guys, excuse the phone. Step 3 would expel excess lubricant, which is really important. Okay, so you've got oil up in the handpiece now into the bearings. Well, you want to make sure that any excess doesn't go into the patient's mouth or during a procedure, because oil and moisture, when it comes to bonding, will affect the bonding process. So you're going to run the handpiece for approximately 10 seconds to expel any excess lubricant. This should be done at the control unit in the operatory, or if they have a purge station in the sterilizer room. If they've got an automatic cleaner and lubricator system in their office, it's done automatically at that point. This step is not necessary if you're using the vector lubricant spray. Basically, it's expelling the oil, the lubricant as it's spraying through the turbine. Place the handpiece in a sterilization bag and sterilize according to manufacturer specification. Always allow handpiece to run through the drying cycle. Okay, that's important. Don't take it out once it's sterilized. Let it dry in there, and run with the plastic side down, paper side up. So if it's in a sterilizer, the paper side is up all the time. So be careful not to pack chamber with too many bags. Stagger the bags so they are not stacked directly on top of one another. If bags are wet or damp upon removal, then that's an indication that you packed your sterilizer improperly. I know you want to try to get all of your hand pieces done as quickly as you can, but you can only put so many in the sterilizer at a time to properly sterilize your pieces. Step 5, let it cool. Okay, so that's gone through the drying cycle. Let them cool down to normal room temperature on their own. Remove the hand pieces from the sterilizer and let them cool down to room temperature. Running a hot handpiece will reduce the life of the turbine. And never run it under cold water. Attempt to cool it down. All you're looking at things, if you've got things that are a couple of 100 degrees and now you're running cold water, obviously your impeller can crack, your spindle and your chucking mechanisms can crack as well. Some guidelines for dentists when they're using their hand pieces and as far as maintaining them. Do not use any surface disinfectants. Use your dry, your pure alcohol. These surface disinfectants has a lot of other chemicals in them other than alcohol. Do not place into an ultrasonic cleaner. It will damage the turbine. Okay, so we've said in our past video, you would take the turbine out. Well, you don't want the doctor taking opening the handpiece and taking his turbine out. So he's just not going to put his handpiece in an ultrasonic scale. Never submerge in water. Okay, that's what's going to cause rust at some point somewhere in the handpiece. Never use hot right out of the sterilizer. Never run under cold water to cool down. It's recommended that each operatory has 5 handpieces for rotation purposes. As long as they've got 4 to 5, the doctor's good. If he's got 1 to 2, all that means is he's sterilizing his handpiece 2 to 3 times a day instead of once a day. That's going to cut down the life of the handpiece, the turbine. So if, when you're talking to doctors and they're trying to get you some warranty, get the handpiece back for warranty, and you find out he's got 4 handpieces because he's desperate for the one he gave you, you need to talk to him about getting more handpieces because you can't warranty handpieces if they're going to the sterilizer 2-3 times a day. Always fully insert a burr into the chuck and secure it properly. If you attempt to extend it from the chuck, then the burr will dislodge during use, causing injury. And basically what that is doctors try to extend the life of their burrs. So instead of seating it all the way into the chuck properly, they won't seat it all the way down to try to extend the life of the burr, which is a real no-no. Never use any type of tool to remove a stuck or broken burr from a chuck. Doing so could irreversibly damage the chuck. Obviously, our special tools to help remove stuck burrs, as we said in this video, really all you're doing is actuating the chuck and pulling out the burr. You don't want the doctor doing this because he may forget to actuate the chuck and then he's going to ruin his chuck if he pulls it out. So you just want to recommend to the doctor to just, if it's stuck, leave it there, give you a call, and you can come take it out. Here again, because of this, because it's a video or a PowerPoint, you're going to show the doctor. we put the 800 number on there, so if the doctor wants to call and ask for a representative, it's going to go through the call center. Well, very good. Thank you very much.